Hey guys, so as promised, I said we would start a new video series around looking at conditions and how photobiomodulation can help that specific condition. So thought we'd start easy and start with osteoarthritis because, you know, it's probably the one clinical case that we probably see day in, day out. We know I think it's 80% of dogs over the age of 8 are affected by OA and 40% of cats over the age of 6. I think the recent statistics in terms of who's impacted. So huge percentage of our client base will have some form of OA at some point within their lifespan. Sorry, evening, struggling to talk. So arthritis, you know, in a normal healthy joint, we have that cartilage, we have a nice healthy joint, we have nice viscous healthy joint fluid, all the nutrients, all the stuff we want. Without OA, it's a degenerative joint disease, so everything kind of is degenerating. The cartilage over that nice bony prominent is wearing away. The viscosity of the joint fluid is reducing. We end up with inflammatory mediators, we're getting pain, therefore we're not using the limbs so much, then they're getting atrophy within the surrounding muscles. And, you know, we end up in this cycle, this pain cycle: reduced muscle, reduced exercise, more pain due to joint instability. So, there are different things that could be an influencing factor for OA. Sometimes it is just genetics and they were predisposed. Sometimes there could be abnormal forces that have been going through those joints. So particularly if they do any repetitive, strenuous exercise kind of over and over again, it can lead to an increased chance of OA. But you know, hindsight's a great thing, but what can we do to actually help manage it? And you know, we all talk about with OA, it's about being multimodal. It's not one thing fits all. You know, there's so many different aspects that we have to look at and consider to make sure we're giving our patients the best care possible. But obviously in this case, we're going to talk specifically photobiomodulation. Now, if we take it back, you know, we know when we're delivering those photons, we're inducing, you know, various different reactions, and we're getting that increase in ATP, that increase in reactive oxygen, that increase in nitric oxide. And, you know, with that in mind, you know, the ATP, we're giving that more energy to the cells there to help with various processes. Nitric oxide, we're going to increase oxygen and nutrient transport, lymphatic drainage. So when we have got those kind of creaky joints that aren't getting the nutrients that we would like them to have, then we're able to help support there. In terms of specifically along the pain pathways, in my previous video we talked about, you know, specifically how photobiomodulation helps manage pain. And the one thing I love about PBMT is that when we're looking at the pain pathways in all phases, it can help. So whether it's the transduction phase, transmission, modulation, perception, you know, we're helping to reduce transmission of those C fibers, we're increasing serotonin, endorphins, increasing beta endorphins. There's so many elements, and I really recommend, you know, if you want to go into a bit more detail around how photobiomodulation specifically helps with pain management, then I really recommend checking out the 2 videos that we did looking at pain specifically. So ultimately what our goal is to reduce pain, reduce inflammation, reducing those inflammatory mediators within that joint space, but also helping with the function of the tissues around it. So, you know, if we're getting more oxygen, more nutrients to the muscles surrounding it, they're going to be healthier. They're going to be able to cope with more strain and be able to be more efficient when exercising. Equally as well, it's any post-exercise, recovery equally as well. So commonly, you know, we'll have arthritic dogs or cats in hydrotherapy, treadmill, pool, whatever it is. And sometimes, you know, they can be a little bit sore after their swim, and we want to try and reduce that as much as possible. So equally, not just for kind of day-to-day maintenance of OA, also helping with kind of pushing our rehabilitation programs and being more successful with those, using laser to support our hydrotherapy to reduce you know, the onset of DOMS, help with that kind of post-swim recovery, the oxygenation of those tissues surrounding it as well. So lots of reasons why we use laser therapy for arthritis, and again, I could spend all day talking about that. In terms of how we implement is really, really important as well. So a couple of top tips when we're treating any OA patients is, don't just focus on the joint that has the diagnosis. We all know compensation is a big issue with our OA patients, so make sure that we are treating any compensatory issues. I very rarely treat less than 3 areas. It's always kind of the main joint, compensatory areas, and then always the spinal segment that is directly in relation. And there's a few reasons for that. Often, obviously, compensation is going through that spinal segment, but also it's helping to stimulate all the nerves and the blood supply that is supplying that limb from the spinal cord as well. So we're helping from that perspective. So always treat compensation as well as the primary areas. And if you can, treat bilateral as often as you can. Great. Frequency of treatment. This is a big one for me, because I find people will kind of see patients maybe once a week for physio for the first few weeks, or maybe every other week. Laser isn't a cumulative effect. We need to be treating more regularly to be more effective and more efficient with our laser treatments. So don't be afraid to offer laser as a separate entity, where, you know, maybe you do your first treatment in that first assessment, but then we need to get them back to have that intensive initial course of treatment. So typically 3 treatments in the first week, 2 in the second week, and then wean them down. But we can't say that a treatment isn't working if we're not following the correct protocol and treating once a week. You know, we wouldn't be able to make a judgment if that was going to work for at least 6 weeks. Whereas if we can treat more intensively in those first couple of weeks, we can get their pain managed quickly, and also, you know, kind of the owner will be more likely to stay on board with us, because they can see that change rather than waiting for 6 weeks down the line. And again, it's difficult because we're not getting that accumulative effect as easily. So follow an intensive protocol. Ideally 3 treatments in the first week, 2 in the second week, and then as long as we are happy with our treatment, then we can reduce down. Another key point is people reduce down frequency of treatment too quickly. We don't want to reduce down treatment until we are happy with the response. So when we get to that, you know, that second week, we've done that 5th treatment or 6th treatment, whatever we're on, are we happy with the response? If yes, great, let's start kind of reducing down that frequency, and maybe go to a kind of once a week, every other week, every 3rd week, every 4th week. If we're not happy, maintain that intensive frequency until you get the response that you're looking for. Really big, important point when it comes to treating OA. And it's an ever-changing disease. It's never progressing disease. You know, so many factors come into it: their lifestyle, what they've done that day or that week, what other treatments they may be receiving. But the great thing about laser therapy is that it's there to suit the patient's needs. You know, we can get them on a maintenance of every 4 to 6 weeks, great. But if they overdo it and they need a bit of a top up, okay, bring them back in. Let's do a bit of an intensive protocol again, and then drop them down again. It's very much, if they're doing well, great, reduce frequency. If they're not doing so well, maintain or increase frequency. And don't forget, you can play around with that, because I think it can be easy to just think of being, okay, we've done this once a month for the last 6 months, and that's the protocol we have to be on. It is a completely flexible treatment for these patients, and it's designed to be so. So those would be my top tips in terms of treating. applying laser therapy as well is remember that there is so much more that's affected in that joint space, or around that joint space, all those muscles, tendons, ligaments. So when you are, you know, applying your laser, obviously if you're scanning, great, you're going to be covering a larger area. If you're point to pointing, the challenge is going to be covering enough tissue to really be effective, but you want to ideally be covering a third above and below joint space, so that you know you're impacting all of the tissues that are innervating that particular joint. So bear that in mind as well when you're looking at your treatment. There's been tons of research around, you know, laser and OA in the last couple of years. Again, on previous videos, you've heard me talk about, there's a couple of papers in particular, one looking at hip dysplasia. Whilst I know obviously not directly OA, obviously we know very commonly secondary to hip dysplasia. And there was another paper that was on elbows, and double-blinded placebo-controlled studies, even looking at direct comparison to meloxicam, and that was a really interesting study to see that actually the scores were better in the laser candidates than it was in the kind of meloxicam candidates, and the effects of the treatment lasted longer as well. So we definitely have a lot more in terms of research around treating OA. So I'd highly recommend taking a look at recent papers if you haven't already. So that kind of is a bit of a summary, a little bit of everything. You know, what is OA, what's causing it, how laser can help, and our top tips for making the best of our treatment. So hope that helps, and I will catch you guys in the next video.